Hello guys, I welcome you all to this very unique question answer session. I've taken such question answer session in past and been amazingly successful. Here I am. I am here to answer all your questions about ankylosing spondylitis. Ankylosing spondylitis is usually considered as a rare disease. But now, as I'm treating more and more patients of ankylosing spondylitis, it seems it's actually very common. We have thousands and thousands of patients of ankylosing spondylitis, and it is increasing. It seems as if it's multiplying with a super fast speed. And the pain it gives, the stiffness it gives, the problems it creates in the quality of life, it has become really, really serious issue to take care of ankylosing spondylitis at the right time. Now, at the right time is the most important thing because people usually wait till they are very, very late. Now, I had a post on this too, why people wait so long. But let us now again focus on ankylosing spondylitis. And for you, I have very, very special updates about ankylosing spondylitis. I was going through ankylosing spondylitis latest news and latest updates, and there was one very surprising finding. And the surprising finding is that you'll be happy to know that antidepressants seem to benefit ankylosing spondylitis pain as well as the quality of life. Now, if ankylosing spondylitis can benefit by antidepressant, it itself means that ankylosing spondylitis have a lot of mind component. Yes, researchers believe that ankylosing spondylitis has a lot of a psychosomatic and a neuropathic component. Now let me explain this too because it is going to be the game changer. Now, antidepressants are being frequently prescribed. Antidepressants and anti-anxiety are being frequently prescribed in the case of ankylosing spondylitis. Not because patients should sleep. No, not like that. Not because patient at times can be in depression, but for a very, very specific reason that it relieves overall well-being and it relieves pain. Now, this is significant proof. This is a significant direct proof that ankylosing spondylitis patients can benefit by working aggressively on mind. Now, I'm not talking about counseling. I'm not talking about psychotherapy. Although I believe it is going to help you. If you have a right attitude, a positive thinking, it definitely should help you. Now, when I say it definitely should help you, it means help you in pain. Now, I'm going beyond this. It means it should help you in stiffness. You heard it right, my dear friends. I had done a lot of experiments with this and a lot of studies on this. So, whenever I see ankylosing spondylitis patient, I usually evaluate how much is the physical component, how much is the genetic component, or how much is the psychological component. When I did this research in physical, genetic, and psychological component, it was found that almost 60 to 80% of cases, I'm seeing plenty of cases nowadays, so I can give you an approximate figure. Almost 60 to 80% of patients have a psychological component. Now, do I mean to say it is a psychiatric illness? No. Do I mean to say it is a completely mind-created unrealistic thing? No. It is actually a physical disease. But like most of the physical diseases, it have a very strong psychosomatic component. Now, is it going to be useful for you? Yes, my dear friends. Ideally, when you think of ankylosing spondylitis, What do you think is, oh, it is a genetic disease and an autoimmune disease, and there is no treatment and no cure and nothing can benefit you. Now, this is the biggest mistake. If there is a mind component, let me tell you first few results. I have seen stiffness reducing in 30 minutes, in 40 minutes, in just 1 hour of the mind reprogramming activities. Yesterday again on Facebook Live, I was asked a question: how mind reprogramming can benefit ankylosing spondylitis? Here I am answering. Mind reprogramming can instantly stimulate your neurology to release some positive neurotransmitters. And these positive neurotransmitters in turn affect your body, reducing the prostaglandins, which are responsible for enhanced pain, feelings, and sensations. So once these neurotransmitters release the prostaglandins, it reduces pain automatically, and you need less and less painkillers every day. Now, isn't it amazing? By just working on mind, you can reduce the painkillers. Means kidney failures. Means you can reduce the chances of further complications. Means you can reduce the need of steroids. Again, going further, it reduces the necessity of methotrexate, DMRDs, disease modifying anti-rheumatic agents. So you see so many benefits just by working on mind. And how fast it acts? It acts just in 30 minutes, 20 minutes, 40 minutes, 50 minutes. Every person takes a different time, but almost every patient almost every patient who trusts this, who believes the therapist, almost every patient gets relief within 1 hour. And is it temporary? For example, if you take a painkiller, somebody come today, okay, I am taking Indocap SR, okay, great. Somebody is taking Zerodol, somebody is taking something else, somebody is taking paracetamol. Whatever you may be taking, are the effects of this painkiller permanent? No. The effect of a painkiller stays for 24 hours. That's it. Even if it is paracetamol, it is even less. If it is a sustained release preparation, it is more. But now this is going to be very interesting, and I know you are having some questions over it. So patient on a painkiller taking daily, and here I do a mind reprogramming activity, and suddenly he feels less need of painkillers. His painkillers go down even to zero. One activity, I have seen painkiller going down to zero. See how much of his damage, internal damage, which is done by painkiller, can be stopped instantly. You heard it right. Instantly. Now, such is the power of mind reprogramming on ankylosing spondylitis. Now, let me tell you another news. So, mind reprogramming works. It definitely works better than painkillers. It also works better than DMRDs. Yes, you heard it right. If you are taking methotrexate, you are going to get some relief. No doubt about it. If you are taking biologics, you are going to get some relief over the period of time. But have you seen the side effects? I was just studying this ankylosing spondylitis news, and what I found that kidney issues are getting increasingly common in ankylosing spondylitis patients. Why? Painkiller, methotrexate, biologics, all have adverse effects on kidneys. Plus, pain and the toxins, pain which is actually releasing negative toxins overall in the body, again impacts the system negatively. So kidneys are at risk. Also, you are having risk of having leukemias and blood cancers and lymphoma. This is a big risk. I will never recommend a biologic or a methotrexate or a steroid without ever going to this, what I recommend, a genetic based treatment. I will never recommend. Because see, this is one treatment, DMRDs, painkillers and steroids, which are having plenty, heaps of side effects. There's another thing which I'm recommending, zero side effect, instant results. Absolutely zero side effects and instant result. What more you can expect? Now, are these results temporary? No. What we usually do, we do a mind reprogram activity and give the audio or a video of that activity to the patient. Now, he's suffering from pain and stiffness. We do an activity and he instantly says, I'm 30% better, or I'm 20% better, or I'm 50% better. But do we stop there? No, we don't stop there. We give that audio to the patient. So that audio is now in his mobile. And then happens the real magic. Now what patient has to do? Patient have to just listen to the audio and follow the step-by-step instructions. Listen to the audio, follow the step once. Okay, yeah, internet is on. So if this mind activity, or you can give mind reprogramming activity, the patient or the sufferer of ankylosing spondylitis, or for that matter any kind of arthritis, does it regularly, twice a day, his complete internal system begins to change. It is very simple. If mind have hatred for somebody, brain will release different kind of neurochemicals. If a mind has love for somebody, brain will release different kind of neurochemicals. And if mind is filled with happiness, it will release completely different kind of neurochemicals, and all the positive neurochemicals have a healing ability. It has been proved in so many researches all over the world. So what these activities do, these activities stimulate your brain to release the positive and healing neurotransmitters, which silence the inflammation, which silence the prostaglandins, which silence all the causes of pain and stiffness. So if he continues to use this twice a day for a few days, or 15 days, or 30 days, or 60, whatever it may be, he continues to get relief, and painkiller and need for medicine goes down. Now, isn't it amazing? What is the side effect? The side effect is a beautiful, positive person. Yes, he's so happy, he's so positive, he's so optimistic about life, he's so energized, stamina increases, appetite improves, sleep is better, and he's not doing any medication for all this wonderful quality of life. Such is the beautiful effects of mind reprogramming, which we are using daily, and the results we are seeing absolutely daily. Amazing, isn't it? Although this is not our main tool, but this question comes very frequently, so I am explaining it. Our main tool is genetically targeted medicines. You can find the video, or if somebody wants to understand how genetically targeted medicine helps in ankylosing spondylitis, I can ask my team to put the link in the comment. So now let us take some question. This is actually a question answer session, but I found this interesting news, and therefore I want to share with you that mind is an important component in your disease. So reprogram mind so that you can reprogram the disease actually. Isn't it great? Let us take some questions. Mr. Ashish Thakur. Ashish Thakur says, what about etacept? Dear Ashish, etacept is a biologic. Now this etacept is a biologic, and it belongs to TNF inhibitors, TNF factor inhibitors class of biologics. Now all the biologics, absolutely all, they are going to benefit you with some cycles. Maybe there are different cycles, weekly cycles, or then 2 days, 2 injections now, and then once a week or once a 15 days, or few even in mild cases are done once a month. So all these biologics are going to benefit you for after maybe 3 to 5 weeks. But then these benefits are usually temporary. It is not going to cure you. Till you take injection, it is better. Now I have news for you. I was just searching news for you so that I can tell you something. So I found the news about this. Let me tell you. If this biologic is taken for long, as soon as you stop it, the diseases can rebound. In some cases, it goes into remission. But till then, it has caused some other complications as well. Now, if it goes into remission and recurs, it is usually more severe, right? One more important thing I want to tell about ankylosing spondylitis is that the news flashed in front of me. So I want to convey, risk of dementia and Alzheimer's disease have been found to be higher in cases of ankylosing spondylitis. Right? So Ashish, etacept will help you. It will help you palliate and relieve. But trust me guys, there is clearly written, there is no cure in the medicines. There is no cure, no reversal. Why not try for cure and reversal? Etacept, as other biologics have, etacept carry risk of cancers, tuberculosis, lymphomas, leukemia, blood cancer. Now, should you really take this much risk? If there is no option and you have a very, very severe disease, go ahead. But then you have option. You have better option, safe option to reverse the disease or even cure it completely. So, etacept, definitely a great biologic. My recommendation is that before going to so many side effect containing treatment, why not go for a safer treatment first, right? Next question, Mr. Avinash Ram. Can we reverse actually between the positive into negative? A great question again. I love this question. Mr. Avinash Ram, see, HLA-B27 is a genetic test. It may or may not turn to negative. But then, ankylosing spondylitis is not equal to HLA-B27. This has been proved. All the patients of HLA-B27 do not necessarily have ankylosing spondylitis, or vice versa. All the patients of ankylosing spondylitis do not have HLA-B27 positive. This means that if I give some medicine, or if somebody gives you some medicine which turns your HLA-B27 positive into HLA-B27 negative, it may not help you at all. Because, for example, your test turns negative, your symptoms remain same or worse. This can anytime happen. So please do not focus on HLA-B27 positive. I know most of the world is now investigation crazy, but please don't be that, because only 70% cases of HLA-B27 positive are having symptoms or vice versa. This HLA-B27 positive is not 100% specific. So don't go for HLA-B27 positive. See your disease reversing without painkillers and steroids and DMRDs and biologics. If it is reversing and you are getting better and better and better with a great quality life and a great positive mindset, I think that is right. Mr. Andrew Fernandez. Mr. Andrew Fernandez, does homeopathy have painkillers that take effect immediately or 24 hours? Take the action within 5 minutes. Even 5 minutes. Homeopathy acts even faster than 5 minutes. But what I recommend here is that don't focus on the pain killing type of homeopathy. Actually, I never give painkiller type of homeopathy. No. Because if you take a painkiller type of medicine, your disease is anyway going to progress from within. Painkiller doesn't stop your disease. Painkiller doesn't reverse your disease. Therefore, we do not resort to painkiller type of homeopathy. I do not recommend. But your question, can homeopathy reduce pain in 24 hours. It can reduce pain in even 5 minutes. I have cases about that I am doing activity, give up medicine, and the patient is better just within 5, 10, 20 minutes. I've done it so many times, and I undoubtedly tell you, just 5 minutes, even homeopathic painkillers can act. But I don't recommend. Painkillers have a short lifespan. Let it be any painkiller, right? Allopathic painkiller have actually most maximum 24 hours lifespan. Homeopathic painkiller have lifespan of more than 5 days, 10 days, 15 days also, but still not recommended because disease have a longer lifespan. So better reverse it rather than taking painkillers, right? I hope Andrew and Mr. Avinash and Mr. Ashish Thakur, you are satisfied with the answer. And Avinash, my team has posted a link for you for a booking free consultation. If you want it, we can see how we can personalize your consultation, and we can give you better recommendation by studying your case. So, okay, let us wait for a few people to join. Mr. Hitesh Singh Chauhan, how you can help me in ankylosing HLA-B27 negative to cure it completely? A great question, Mr. Hitesh Singh. See, ankylosing spondylitis have basically two components. One is genetic component and other is a psychosomatic component. Now, genetic component is interlinked with autoimmune disease. So this autoimmune genetic component is one of the very, very strong component. Another very strong component is the psychosomatic component. You believe it or not, experts agree that almost all these kind of diseases, all the modern diseases have a great psychosomatic component. And I have tested it, verified it, and seen results in so many cases. So I don't have any doubt about it. So if you say you are a HLA-B27 negative or positive, actually it doesn't matter. If you are positive or negative, the treatment is going to be same. What you need to do is, you need to focus on what exactly caused disease in you. This is not HLA-B27. No. I am very sure that it is not HLA-B27 which has caused disease in you. No. It is something else. Now let me tell you something else here. A bad past, a mental trauma, a big loss, a child abuse, or history of a recurrent abuse, or bereavement, somebody died in a family, a strong grief, a mental shock. These are the kind of things which make you prone for a depression and higher stress levels. And as you all know, most of you know actually, that ankylosing spondylitis is very closely linked with stress, depression, rather than anxiety. Stress and depression rather than anxiety. So this stress and depression combinedly reduce your immunity. And once they reduce your immunity, any kind of disease can come in. One of disease here is ankylosing spondylitis. So what we need to work on is, we need to work on changing your genetic expression, which can be done by genetically targeted medicines. Second we can do is reducing the impact of any past stressors. If there's any past stressors, you can reduce the impact, you can minimize the impact, and the great thing is, you can nullify the impact completely. And once you nullify the impact, great, your complete past history is going to change. And if you can rewrite your past to completely new past, you are just a product of your past. You will change, right? And regarding psychosomatic component, we need to work aggressively by mind reprogramming. Just counseling may or may not help. It may not help a lot of, but the mind reprogramming is going to help you a lot. So, Hitesh Singh, we can help you completely reverse your ankylosing spondylitis and completely reverse and cure it, so that you enjoy a happy, safe, and normal, good quality life. Will it not be wonderful, Hitesh? Right. Let us check it out. Any question? So I welcome Mr. Shafi Khan. Yeah, Shafi, welcome. Mr. Harpreet Singh. What is biologic injection? Can it stop AS? Mr. Harpreet, biologics are the injectables prepared from live microbacteria. These are the genetically engineered proteins. Now, being protein in nature, they have the capacity to alter the immunity, alter the immunoglobulins, and hence influence the immunity. By this way, they can put disease into remission or they can give you a substantial relief. But as your question is, can it stop AS? No, it doesn't stop AS. It relieves you. It can put you into remission, but silently the disease continues to grow and it relieves temporarily. Because what the news in front of me is saying that as soon as you stop injections, disease can come back and come back wild, right? So it cannot cure AS. It can give you relief. It can make it stand still for a while, but then it comes back with vengeance. Regarding AS again, Harmeet, it looks like regarding biologics, you are new. So let me tell you, biologics have a lot of side effects, and the side effects, as I just mentioned, can be as severe. It can be mild from feverish feeling to fatigue and weakness to the severe to immunosuppression, leukemias, blood cancers, lymphomas, and kidney failures. So it can be so severe. Mr. Avinash, thank you. You are most welcome, Avinash. Andrew Fernandez, yeah, welcome. Welcome, Mr. Abhijit. Avinash Ram says, as a biology teacher, I am eager to ask you how we can alter the expression of genes without gene therapy. A great question. I love this question. See, Mr. Avinash, let me talk that suppose Avinash is my friend and I want to understand Avinash. There can be two reasons. I can take your blood sample. Then I can put your blood sample under a microscope. I can go inside your DNA. And then microscope will go inside your gene and try to understand you. And you will understand this is going to fail. Why it fails? See, Avinash have a gene and gene defines Mr. Avinash. I am studying genes. I should be able to understand Avinash. But no, it won't happen. The better method will be I sit in front of Avinash and see how is the face structure of Avinash. Is it square or round? Or see what is the mental pattern or thinking pattern, what is the nature, what are the preferences and dislikes and likes of Avinash, and then I understand Avinash better. Right? So I talked about two different things. One is going inside the cell and gene to understand you, or just staying away and understanding the genetic expression. Means whatever I am looking, I am here right now, is expression of my gene, isn't it? Only there are few things which are learned, but essentially I am an expression of my gene. So if you remove the acquired characters and just see the raw genetic expression, you can understand me better, right? Raw genetic expression means my original nature, original behavior, my childhood likes, my childhood dislikes. So these are the genetic expression which can help you understand me better, which can help me understand you better, right? So this is the internal way and external way, or I can say invasive way or a understanding way, comprehensive. And understand genes externally. Similarly, now this note down, Mr. Avinash and all others note down. Science of epigenetics have proved that you can influence genetic expression without entering in the gene. Because what epigenetics says is that our genetics is under influence. It is influenced by psychosocial factors. It is influenced by medicinal factors. It is influenced by environment. So if your genetics is influenced by so many things, will it not be smart to use all these things take it under control, and use all these things to influence your gene to change your genetic expression to get an amazing health. And we are doing it amazing results. Science of epigenetics is actually giving new hopes to ankylosing spondylitis patient. And guys, most of you will be skeptical about new advances. But no, science of epigenetics and neuroplasticity have been proved to exist. And they are here to exist, whether you trust it or don't trust it. So if you study epigenetics, you will understand your genes and genetic expression are under constant influence. Now the question is, are they under unconscious influences, you being unaware, or they are under conscious influence of a genetic therapist like me or somebody else who knows it? So it's better to put it into conscious influence to change the genetic expression. So Mr. Avinash, I hope it answers your question. If no, please write it again. You can just ask question again. Dr. Akash, welcome. Dr. Shweta, welcome here. Mr. Harmeet Singh, yeah, thanks. Hitesh, thanks. Avinash Vishwakarma. How long time it takes to reverse the AS and to completely cure? Avinash, a nice question. But then this is a completely personalized treatment. For example, suppose I take 5 patients of AS. Each of these 5 patients have developed AS because of some other different factors. Each person is different genetically, each person is different physically, each person is different psychologically, each person having different system, each person having different kind of food and diet habits. So when everything is different, treatment is going to be different. So we believe in customized and personalized treatment. We always do this for all the diseases, not only for ankylosing spondylitis. For all the diseases, we have tailor-made, customized and personalized solutions. Now, if you are aware of the medical science now, medical science is completely moving from a generalized approach to a spatial and a personalized approach. If you see any ankylosing patient or diabetes patient, all getting the same treatment, generalized, completely generalized. And as we come to here, at advanced health, we have completely personalized. We study every case into depth and details. And once we study every case into depth and details, we are surprised almost every time. Yes, we get something as a trigger factor. We get something as a triggering cause. And once we deal with the cause, the inner reality changes. Now, this is something amazing about any disease, and especially also true about ankylosing spondylitis. Right? So every person will take some different time. Harmeet Singh, is buprenorphine tablet help me from pain in joints? Yes, it can help you in pain in joint, but then Mr. Harmeet, it is not a good medicine to take. The better way to answer this will be, it can help you relieve the pain, but it will be very expensive proposition. If you go to the side effect profile of buprenorphine, there are so many side effects, and you will never want these side effects with you. So please go to the side effect profile and think of something better and safe for relieving your pain. Don't resort to buprenorphine, because buprenorphine is not a simple painkiller. It is actually a hypnotic sedative painkiller. It is also used in anesthesia while we are going for a surgery. So it is not a tablet worth to be taking. It is also addictive. It is in long term, it is addictive. So avoid it, Mr. Harmeet. Mr. Bikam Sethia. Okay. Oh, thank you. Thank you, Sethia. Andrew Fernandez says, most research suggests that AS arises due to bad gut health. How far this is correct? Andrew, I love this question. Gut, the leaky gut. The leaky gut is a famous term, right? So leaky gut have been labeled as responsible for all the autoimmune diseases, including ankylosing spondylitis. How far this is true? I think it can be true a lot. Why? I have a complete scientific logic behind it. Again, going to epigenetics. If you see epigenetics, your genes and genetic influences are under constant influence of the factors like I told you, psychosocial factors and medicines. So when you are taking some medicines like antibiotics, your favorite, isn't it? It shouldn't be. So if you're taking antibiotics of plenty, one thing antibiotics do is they destroy the gut flora. They destroy the normal bacteria so that the immunity, the gut immunity goes down. So now when I say goes down means gut immunity is reduced. But ankylosing spondylitis is not just a result of reduced immunity. It is result of distorted immunity, autoimmunity, all guns firing on ourselves. Now why this happen? When we insult gut flora, with antibiotics, it reduces immunity. Then we take probiotics to replace gut flora. Then we again take antibiotics for some other reasons. We destroy gut flora. Then we again take probiotics. When this happens repeatedly, our immunity gets distorted. Why it gets distorted? Because till then, these antibiotics and medicines have disturbed your immunity so many times that your genes distort immunity and it turns to being autoimmune. So yes, some issues start from gut. But then my question will be, why gut issues have appeared for the first time? So medicines can be a very strong reason behind all the autoimmune diseases. All. Another important factor behind all the autoimmune diseases, I'm again speaking very, very specifically, all the autoimmune disease is vaccines. Because the day the kid is born, he is given a vaccine. We meddle with the natural immunity and we pay the price. Whether you agree or not, but this is the fact. So yes, gut immunity can play a role. Mr. Harmeet says, thank you. Thank you, Harmeet. Harmeet, thank you. We are doing incredible work. Let me tell you, since before few years, I was not having more. I just treated one patient initially. It was six years back. Very poor result. Since then, I went into deep research and deep study of these cases, and now I have actually cracked the code. Yeah, you can say we have actually cracked the code of ankylosing spondylitis, and let me tell you, my team is doing amazing work in this. We have a special team to work on ankylosing spondylitis, and they are doing incredible work. Even they don't need me, let me tell you. I'm very proud of my team, and I'm proud to say that they don't need me to work on ankylosing spondylitis. And they're amazing. So it is better if you can take their help. So thank you, Harmeet, for your appreciating words. Mr. Shailendra, good evening. Yeah, good evening. How to prevent spine stiffness daily in the morning? A great question again. See, the best part is what you know is about exercise and physiotherapy. Yes, you should go for it. The best form of exercise, if possible for you, in this present moment, can be swimming. Swimming can be great exercise. Or you can walk or jog or run. Or you can go for Surya Namaskar. Or you can go for daily routine of a complete exercise. Don't just resort to one. Swimming is a complete exercise. It exercises your hands and shoulders and everything. Right? So go for something complete. If you say, sir, I daily jog, it is not going to help you. No. You need to see that all the joints are mobilized daily, morning and evening. So this is important to prevent stiffness. So if you can do this, you can definitely prevent stiffness. But what I say, I propose, Shailendra, you cannot prevent this for long. You can prevent it for a few days. If you do all the exercises, your stiffness will be prolonged. Your stiffness, the onset of stiffness will be prolonged. It will come late, but it will still come. It will still come because the underlying process which have caused this inflammation and stiffness have not been taken care of. So what I recommend is please go for inner treatment before just resorting on exercise. If you're doing exercise, great. If you're not doing, start right now. right from today. Before sleeping, do some exercises. But think, if you just exercise and exercise and exercise, it is going to help you for few days or months. It is not going to help you for life. You cannot exercise for life, right? So it is better to get it treated internally. The treatment within is very, very important, right? So although you should go for exercise, better you go for a genetic-based treatment. If you want a free consultation, we are giving, this is a AS awareness month, and we are giving completely free consultation to all the AS patients all over the world. You can take benefit of that, right? So there is a link being posted for a free consultation. You can just go to the link, click and book your free consultation. And please mention your issue. What is your issue? Stiffness is the issue, or neck pain is the issue? What is the issue? Please mention that issue. And if possible, also mention the city so that we know where are you from. Let me tell you one more thing. I am taking a health mastery seminar on 5th of May. 4th May is the Ankylosing Spondylitis Day. So I am making this health mastery seminar and exclusively dedicated to ankylosing spondylitis. So if you have come down to that seminar, that workshop, there is an actual practical workshop where you can experience what kind of life you can live by changing your health internally. You can actually experience it. So come down to that workshop and you will just love it. So Shailendra, you are welcome there if you want to come, if you can come. Mr. Avinash, yeah, thank you, Avinash. Mr. Andrews, thank you. Mr. Praful Ranjan Swain, welcome. Neil Garg, welcome, Neil Garg. Yes, Mr. Shailendra, even I will love to meet you as soon as possible. I have one more important news to share. Till then, if you want to ask some question, please just ask, because this is going to be a very, very important news for you, right? Let me take your news for you. This is another very, very important news here. Whatever you take, anti-tumor necrosis factor inhibitors, like these biologics, or whatever you are taking, they do not reduce spine deformities in long run. It appears they are reducing. There is less pain, there is less stiffness, but then deformities eventually appear, right? So the long-term benefits are not too great with this kind of patients, in this kind of therapies. Hitesh Singh Chavan, where will be the seminar? Hitesh Singh, it is in Mumbai. It is in Mumbai, Vile Parle. Mumbai, Vile Parle is 5th May, morning 10 a.m. to 6 p.m. You will be with me and my awesome team, and we will be doing some incredible, awesome exercises, some mind reprogramming exercises, so that you benefit right then and there. It will be amazing. So please be there. It is a Hotel Bawa International and Vile Parle East. Or you can just, maybe my team will put the link there. Dr. Akash, Dr. Shweta, can you please put the link of our Mumbai workshop there so that they can just join? So Hitesh, if possible, just come. Yeah, the link is already posted, Hitesh. You can just register through this link and we can meet face to face personally. Right? So any more question? Okay, let me tell you, till the questions come, let me tell you about a case which I just liked. Recently I went to Bangalore and there was an amazing guy. Just young age, 21, 22, he was having severe pain. He was frustrated from ankylosing spondylitis. He was from Calcutta, came to Bangalore to meet me and my team. So from Calcutta he came to Bangalore, and then he didn't have the good financial condition. So he collected some amount from his friends, and then finally he was ready for the treatment before we go there. When we went, he talked to one of our genetic consultant, and she convinced him that he should take it. He was still skeptical. Now let me tell you, you can take it lightly, but usually ankylosing spondylitis patients have a lot of skepticism. Usually, but this hurts you. Huh? If you are rigid in your mind, you are going to be rigid in your spine. This is true and true. So that fortunately that particular guy understood what our genetic consultant Dr. Shweta wants to convince, and then he was convinced and he joined. Now when he joined, there was no time for a complete case study. So what we do, we did a short case study, and then we did a mind reprogram activity. Now after we did a mind reprogram activity, it was approximately 30-40 minutes. Immediately after activity, I asked him to just go move around in the hotel. So he went move around hotel, just climbed the stairs, then downstairs and up the stairs, and then he did all the activity which he was not able to do. And then he came to me. I asked, "How are you?" He said, "Actually, I'm feeling 30 to 40% better." Can you believe this? You have to. You have to believe this, because this is completely, it's just less than 1 week. So just in 40 minutes, the complete disease change, stiffness change, pain change. Now this is the proof that there is a big reversibility available. If a disease can change in 40 minutes, who in the world do not want to change it? You must, right? So I will post the video in the link. Dr. Shweta, can you please post the link of that video, the Bangalore patient whom we reversed in just 40 minutes? So please post that video in the comment box. You will be seeing Dr. Ravi Vairagade posting it, but actually it is my incredible team who is doing all the job. So Mr. Avinash, sir, please tell the average time duration for the genetic treatment for complete cure. I can't sit since last 10 years. Mr. Avinash, I understand your problem. The best thing will be that you go to some of the link and register a free consultation. Let us understand you better. Why we are giving you free consultation? Because unless we understand you, we cannot help you. It is not a blanket treatment. Okay, take this medicine for everybody. Take Humira, take Remicade. No. Take Etanercept. No, it is not like that. We need to understand your story. We are ready to hear your story. We need to understand what you are suffering from. We need to understand what kind of problems and challenges you are facing. We need to understand what you are exactly going through. And then we need to understand why you are going through all these things. And once we know the why, we can change the life. Yes. So therefore, guys, take complete benefit of this free consultation link. If possible, share these links to as many people as possible. We will love to help all around the globe. So we have all the system like Skype consultations and telephonic consultations and WhatsApp consultations, and we can help you do with this kind of consultations, right? So just go ahead for the consultation. So Mr. Avinash, we need to understand you more and more to help you better and better. So please take advantage of this free consultation, right? I consulted since last 10 years. Doesn't matter. We have cases where 20 years have passed, patient is not well, and now he is reversing like a magic, right? Mr. Harmeet Singh, sir, I have AS for like 23 years and feel severe stiffness into chest and ribs also. What I do and want to meet you. Okay. So yeah, Dr. Shweta, can you please mention that link of ankylosing spondylitis reversal, magic reversal, write it. Ankylosing spondylitis magic reversal, and then give the link so that people understand which link belongs to what content. So Mr. Harmeet, coming back to you, you have ankylosing spondylitis from 23 years. And Harmeet, what a correlation. I have this experience of treating these kind of diseases since past 23 years. When I say this 23 years, I say it is a huge experience. So when you say it is 23 years of pain, I understand it is a huge problem for you. It is a big trouble for you. Don't worry, Mr. Harnik. We are with you. Whatever the duration is, it doesn't matter. What condition you are in, we need to study that, and then we will suggest you what kind of treatment you can take and you should take. We have a simple treatment and a very premium treatment. We are, practically speaking, we are the only people in the world, me and my team together, we are the only doctors in the world who are treating ankylosing spondylitis by a genetic holistic way, using all the modern sciences of epigenetics and neuroplasticity and mind reprogramming and genetic reprogramming. Now, I'm not telling this to just say something about me or my team. No, I am telling this so that you feel that there is still a hope. So don't worry, whether it's 23 years or 25 years, doesn't matter. Let us understand. Go to the link, book a free consultation. Let us understand you so that we can suggest an appropriate treatment for you. Mr. Harmit, this is going to be a life-changing for you because it freezes your life. Let us release your life for more happiness and more fun in life. You deserve it, Harmit. So please book the consultation and let us help you out of this. Yeah, there's a posted a link of AS patient pain reduced in 20-30% in just 20 minutes. So you can go to the link and enjoy amazing change. If you feel, please share this video and other videos to maximum people. I know you are a great community. Ankylosing spondylitis people are in a great community. They are great in supporting. If you find this as useful, please share to as many groups as possible. Please share to as many ankylosing sufferers as possible. Although ankylosing patients are called warriors, but then they are actually suffering a lot. They need a ray of hope. Your sharing of this video can give them a real hope. What I am telling you, I have lots and lots of proof about it. I can give you so many links and so many videos, but why just restrict to seeing videos? Why not make a video yourself? Isn't it? Why just watch another video? What I propose is come down here, right? Come down, join our treatment. We will do activity on you and we will prepare a video for an amazing result in just minutes. Let it be disease of years standing, doesn't matter. We can change it in few minutes. Your story can change. Your life can change. Your disease can reverse. There is still a hope. Don't lose hope. It is your life. You are just one life. Don't sacrifice your life for ankylosing spondylitis. Okay, guys, I think I have answered almost all the questions. Let me check around. If there are some questions, please post. Even if you are not watching it live, even if you watch it after the live is over, you can still post the question and me and my team will be very happy to respond. We will love to respond to your questions because we love to help you. This is AS Awareness Month and we are doing a lot of AS awareness activities and we also have some great discounts for AS patients all over the world. Then I am getting continued requests. Now what I'm seeing is that I have still requests on a YouTube about ankylosing spondylitis, right? So book a free consultation. Let this awareness month be a life-changing month. So here I say bye-bye to you. Bye-bye guys. Take care. Stay healthy. Stay blessed. Take a decision to change your life. And me and my team are with you for this life-changing journey. I invite you all for this incredible life-changing journey to give a gift called a beautiful life to you and your family. Thank you, my dear friends. Bye-bye. Take care.